She is also the Deputy Chair of the Clinical Ethics Committee at KKH, and she'll be talking to us on ethical issues in adolescent health today.
Thanks, everyone. So I'm an adolescent physician, so I deal with probably the group of individuals that a lot of people wouldn't really like to deal with sometimes. I'll just state that's my disclosure. I have no other disclosures. I was trained in actually Royal Children's Hospital in adolescent health in 2007, and I'm the first adolescent physician here in Singapore. So just out of context, so WHO defines adolescence basically in the second decade of life, between the ages of 10 to 19. Youth are considered 15 to 24, and young people 10 to 24 years of age. And you can kind of divide it in early, middle, and late, where there's early, you have a biological focus. They generally begin with puberty and ends with the adoption of adult social roles and responsibilities. Today's generation of young people is the largest in history. Over 1/4 of the world's population are aged between 10 to 24. And close to 90% of young people live in low or middle income countries. And an estimated 70% of behaviors of premature deaths are due to behaviors that begin in adolescence. So I'll just talk a little bit about autonomy and vulnerability. Autonomy is the capacity to think, decide, and act on one's free will. Every adult is assumed, I always say is assumed, has the capacity and competence to decide whether to consent to or refuse proposed medical intervention. And so we heard a little bit about competence and capacity. From what I was reading, capacity often has a lot of legal connotation. Right? We have a Mental Capacity Act. Competence is more whether you can or cannot decide, and whether you understand the information presented to you, right? Unless it is shown that they cannot understand information presented in a clear way, they don't have that capacity. Vulnerability. So as pediatricians, we deal with the vulnerable population. And vulnerable persons are those who are relatively or absolutely incapable of protecting their own interests. More formally, they may have insufficient power, intelligence, education, resources, strength, or other needed attributes to protect their own interests. And children and adolescents are under that group. Now in Singapore, the Children and Young Persons Act actually covers up to the age of 18. So you are considered a child if you're 14 years and below, right? And up to the age of 14 and up to 18. It used to be up to 16, but it was only, I think recently in the last 2 years, put up to 18. So in Singapore, the alcohol minimum age to purchase is 18, driving minimum age is 18, but cigarettes minimum age to purchase is 21. So minors are those who have not acquired autonomy, and those who are vulnerable are those who feel they cannot assert their autonomy. So the disabled, the marginalized, the stigmatized, the disempowered, those that lack resources and lack institutional support. So what are the ethics that I deal with a lot of the times? I come here as a clinician, not as a bioethicist, okay? So the basic issues that we deal with is consent, capacity and competency in a minor, confidentiality issues, best interest, and of course, advocating for the vulnerable population when they have no voice. Now, this is the teenage brain. Pictures of the brain in action show that adolescents' brain works differently than adults when they make decisions or solve problems. That's because the prefrontal cortex is still developing. Teenagers might rely on a part of the brain they call the amygdala to make decisions and solve problems more than the adults do. The amygdala is associated with emotions, impulse, aggression, and instinctive behavior. Risk-seeking behavior in teens is not abnormal. They've been doing it for thousands of years, okay? It is part of their developmental process. The difficulty is, unlike children who walk, talk, and do things at a certain age, that wide age group it doesn't come at a specific time. Some 15-year-olds, are very different from other 15-year-olds, So it is very much a biopsychosocial construct. But Piaget's stages of cognitive development states that at formal operation, 12 years to adult, the adolescent can reason abstractly and think in hypothetical terms. So we talked about adolescent health issues, and we talked a little bit about what they are. So there are persisting health problems from childhood. There are manifest youth health problems, such as mental health issues, substance use, accidental injury, antisocial behavior, eating disorders, and risk for later disease. Like I said, 70% of a lot of adult behavior that causes mortality and morbidity starts in the adolescent or young people's age, right? Tobacco, obesity, inactivity, poor diet, substance use, sexual health behaviors, and again, mental health issues. So what about competence in a young person? So adolescents' rights to make decisions for themselves often depend on their ability to do so, but in law, it's often defined by how you perform a task. Like we said, driving is at 18 years of age, But owning a dog, and giving that responsibility, often below that. Usually the mothers do it though. Age of consent is often age of majority, right? And in Singapore, the age of majority is 21. If you Google age of majority, there's a wide range of age of majority around the world, as low as 12 and as high as 21, okay? The teenage brain does not completely form, and this was alluded to yesterday, till you're 24. So do you move that age to 24? Because it is actually proven it does not completely form till 24. So WHO is actually quite right, 10 to 24. To enter into contract in Singapore, it's 21 years. And the age between 18 to 21 years is actually, you can consent to procedures and treatments because you're not considered a minor anymore, right? When you're married or a parent, then you make decisions for your child. Singapore has one of the most liberal termination of pregnancy laws when it comes to consenting, and I just won't go into it now because it might take a bit long of a debate. Between the age of 14 to 18 years old, it's presumed that you can apply Gilead competency. But actually, if you look at Gilead competency in this law, it was 16 years and below, and there is no bottom out, if I'm not mistaken. So this is a presumption by the laws, because laws often dictate how you do things, right? So what about competence? So I follow on, and I think it's pretty nice that I follow on Cheryl and Teck Chuan. What is competence to consent to treatment? You need to have qualities associated with self-determination, the cognitive ability to understand and communicate, able to reason hypothetically and deliberate, sense of rationality and self-identity. And like I said, you can talk to a 16-year-old and you can tick this off, or you can talk to another 16-year-old and you can cross them all off. So it's quite difficult, right? But a young person should be able to understand simple terms, nature, purpose, and necessity for proposed treatment, the benefits, risks, alternatives, and effect of non-treatment, believe that the information does apply to them, retain information long enough to make a choice that's free from pressure. So this is actually the judgment on Gilead competency. As a matter of law, the parental right to determine whether or not the minor child below the age of 16 will have medical treatment terminates if and when the child achieves sufficient understanding and intelligence to understand fully what is proposed. Okay, so can consent to treatment if sufficient intelligence and understanding? Who decides that, right? As Teck Chuan says, is it a court of law? Is it the clinician? Is it disease specific? Is it person specific, right? But ethically, as health professionals, we do have a duty to respect the rights of the adolescent, provided that the consequence does not result in harm to the adolescent or to others. And that's when often best interests will trump. So what about in Singapore? Has this been tested? I have mine. So a man has filed a court application to pave the way for his 16-year-old daughter to get the COVID-19 vaccination after his ex-wife, who shares joint custody of the teen, opposed the jab. The man is seeking a court order to allow his daughter to be vaccinated and for his ex-wife to bear the cost of his application. He is a permanent resident, she is a Singapore citizen. They're divorced, and I think they both have joint custody, right? He has since remarried. He himself is vaccinated, claims that his ex-wife is strongly opposed to allowing their daughter to be vaccinated. So this came up in family court. And for the first time, I think guilt competency has been written in judgment in a court, although it's family court. It's not the APEC court, but it's family court. So when I was asked about this, I thought, well, it's kind of gillicky, isn't it? It would be more guilt competence, I would suppose, if she wanted, and the parents both opposed, whether they were together or not. Mind you, there's a third shadow in the background of this, isn't it? It's called the government, right? The COVID vaccination was strongly encouraged, right? Strongly encouraged. It was meant to be voluntary. So it's quite an interesting judgment, and it was good fun to actually read it. But I felt it was kind of 3 against 1. Not that I agreed with the mother, but it was more or less 3, in my opinion, it was 3. But this is the first time, because for many, many years it's been stated that guilt competency has never been actually applied in Singapore. But I think this is the first time. And there is actually differing views on whether it is truly applied or not. Okay? So what happened? So court rules in favor of father who wants his 16-year-old vaccinated, but whose ex-wife opposed. So I'm going to talk a little bit about stigma and discrimination, following on actually our speakers beforehand. So stigma is an attribute that is deeply discrediting and that reduces a person in the mind of others from a whole and usual person to a tainted and discounted one. The attribute referred to must have an enduring condition that engulfs the entire identity. Now, this is a psychological sort of a philosophical view of a person and its identity. Discrimination is the unfair or prejudicial treatment of people and groups based on characteristics such as race, gender, age, or sexual orientation. Okay? I like to use that photo for health equity and equality. I use that to explain to my 17-year-old niece what that means. So stigma is a well-documented barrier, and Cheryl alluded to loss to follow-up, right? And that is, it's a well-documented barrier to health-seeking behavior, engagement, care, and adherence to treatment across a range of health conditions globally. And I'm looking at mental health as a stigma. The state of youth mental health in Singapore is actually around the world, and during COVID, has been examined quite a bit over the last couple of years, right? And it's one of those things that we battle, amongst many other things. What about the problem in youth mental health? What is it? So, serious mental health issues begin early in life, okay? 1 in 5 of all children and adolescents. 50% develop by the age of 14. 75% by the age of 24. What about in Singapore? To give a local context, this is a recent study that I don't think has been published yet by NUH Psychiatry and NUS Psychology in collaboration with the Ministry of Education about our youth. 1 in 3 youths in Singapore reported internalizing mental health symptoms such as depression, anxiety, and loneliness, with those aged 14 to 16 reporting more serious symptoms. 1 in 6 experience externalizing symptoms such as hyperactivity, rule breaking, and aggression. And 1 in 10 meet full diagnosis of a mental health issue. So there is a talk about a mental health tsunami before the silver tsunami. The number of suicides last year showed a concerning rise of 25.9% from the 378 reported in 2021, and remains the leading cause of death for youths aged 10 to 29 for the 4th consecutive years, and it's the highest in the last 22 years. If I cannot say enough. So confidentiality then, do they have a right to it? The right to confidentiality exists independently of the competence to consent to treatment, and encourages mutual trust, exceptions when further risk of harm. So harm to self, harm to others, or whether someone is harming you. That's the 3, and I always tell my teens that. Then comes this issue. Do we allow youth above 14 to seek mental health help without parental consent? And this is a call from mental health treatment providers, especially if the parents might be the ones that are maybe not so helpful, right? So I don't know. I do not have any of the answers. I just see this as a problem. So like I said, this has not changed in many years. Our youth love luxury. They have bad manners and contempt for authority. They show disrespect for their elders. They love idle chatter in place of exercise. Children are tyrants of the household, not the servants. They contradict their parents, chatter before company, gobble up their food, and tyrannize their teachers. Things have not changed much since Socrates' time. I thank you.